Fibroids affect about 20 to 40% of women in the reproductive age group, and it can cause severe effects in about few patients who are suffering with fertility. If the fibroids are subserosal, that is outside the uterine cavity on the wall of the uterus more than 7 centimeters, or they are close to the tubal area, they can be removed surgically by laparoscopic method. I'm Dr. Lakshmi, IVF consultant, Sri Ramakrishna Hospital, Coimbatore. Today we shall discuss about fibroids and its effect on fertility. Fibroids affect about 20 to 40% of women in the reproductive age group, and it can cause severe effects in about few patients who are suffering with fertility. The most important reason for fibroids, how it affects the fertility, is by its location, size, number, and other factors. Location is the most important reason. For if it is inside the uterine cavity, we call it submucous fibroids. If it is entirely placed inside the uterus, or it is at the wall of the uterine cavity, then it can have a detrimental effect on fertility, because it enlarges the cavity, it distorts it, it will affect the passage of sperm from the cervix to the uterus, transport of the embryo, implantation, and if it is a pregnancy, it can cause miscarriages and bleeding heavily, painful periods. These are the various effects of fibroids if they are placed inside the uterine cavity. Then the fibroids which are close to the uterus in the muscle, that is, they are called intramural fibroids. If they are occupying or compressing and pressing the cavity or abutting the cavity, then it can affect the fertility, again by distorting, enlargement, and preventing the transport of this. So these fibroids need removal, and then only there will be an increase in the pregnancy rate. The second most important factor is the size. Size, if it is more than 5 centimeters and above. You can look at the uterine muscle, it is just about 2 centimeters. But if the fibroid is more than 5 centimeters, then it will definitely distort the uterus, and thus it requires removal. The third is the number. If the numbers are more than 5, that is 3 centimeters and above, they are more than 5, or they are placed close to the uterine cavity, they would all require removal. The fibroids which are at the wall of the uterus, that is called subserosal fibroids, and that they do not have much effect on the fertility. But if they are very large, that is more than 7 centimeters, or they are coming close to the tubal area, then it requires removal by surgical methods. Now, there have been a lot of studies, especially in women undergoing IVF, who have got fibroids inside the cavity, that is the submucous, or the fibroids which are compressing the cavity must have the removal, and the studies have shown that the pregnancy rates doubles after the removal. If the fibroids are subserosal, that is outside the uterine cavity on the wall of the uterus more than 7 centimeters, or they are close to the tubal area, they can be removed surgically by laparoscopic method. The fibroids which are inside the uterine cavity can be removed hysteroscopically. It depends upon the surgeon's ability and the skill. These fibroids can be easily diagnosed by ultrasound, and if they are multiple, they can be diagnosed with an MRI. Medical therapy does not have much role in treating these fibroids, so it is the surgical management which will required to correct the fibroids and help in fertility. We at Sri Ramakrishna Hospital have a good set of laparoscopic surgeons who are very skilled in doing these sort of surgeries, and they have improved our results, and given us a good pregnancies and take home baby rate. Thank you.